Bonjour tout le monde et bienvenue à cette mise à jour sur le COVID-19 au Nouveau-Brunswick. Les porte-parole aujourd'hui sont le médecin hygiéniste en chef, le Dr. Jennifer Russell, l'honorable Dominic Carty, ministre de l'Éducation et du Développement de la Petite Enfance, et l'honorable Blaine Higgs, Premier ministre. Good afternoon, everyone, and welcome to today's update on COVID-19 in New Brunswick. Speaking on behalf of the province today are Dr. Jennifer Russell, the Chief Medical Officer of Health for New Brunswick, the Honorable Dominic Carty, Minister of Education and Early Childhood Development, and the Honorable Blaine Higgs, Premier of New Brunswick. Dr. Russell.
Merci, Bruce. Thank you, Bruce. Good afternoon. Bonjour à toutes et à tous. Nous avions tous prévu que l'hiver serait difficile et qu'il y aurait une augmentation du nombre de cas de COVID-19 à l'arrivée de la deuxième vague de la pandémie. Mais notre situation est devenue bien plus sérieuse dans la province, en particulier dans le nord-ouest du Nouveau-Brunswick. Nous devons agir dès maintenant pour empêcher ce virus de faire encore plus de dommages que nous voyons déjà. Aujourd'hui, j'annonce qu'il y a 36 nouveaux cas confirmés de COVID-19 au Nouveau-Brunswick. C'est le plus grand nombre de cas signalés en un jour depuis le début de la pandémie. Ce qui est plus troublant, c'est que 24 de ces nouveaux cas ont été signalés dans une région, la zone 4, qui est la région d'Edmundston et de Grand Sault. C'est de loin le plus grand nombre de cas signalés dans une seule zone en un seul jour depuis notre premier cas de COVID-19 qui a été rapporté le 11 mars 2020. En un jour, le nombre de cas actifs dans la zone 4 a augmenté de plus du tiers, passant de 52 à 76. We all expected this would be a hard winter and that we would see a spike in cases of COVID-19 as the second wave of the pandemic arrived. But our situation has become more serious across the province and in particular for northwestern New Brunswick. We must act now to keep this virus from doing even more damage than we are already seeing. Today we have confirmed 36 new cases of COVID-19 in the province, and that is the largest number of cases reported in a single day since the pandemic began. But more troubling than that is the fact that 24 of these new cases were reported in one area, and that's Zone 4, which is the Edmundston-Grand Falls area. This is by far the most cases reported in a single zone in a single day since our first case of COVID-19 was reported in March 2020. In one day, the number of active cases in Zone 4 jumped by more than one-third, from 52 to 76, and it is now clear that the majority of the cases being reported in Zone 4 are linked to one workplace area. Compte tenu de ces faits, Santé publique a recommandé au cabinet que le Zone 4 passe à la phase d'alerte rouge dès minuit ce soir. De nombreuses entreprises devront donc fermer leurs portes ou ramener leurs services au niveau essentiel. Nous demandons à toutes les personnes dans la Zone 4 de rester chez elles autant que possible au cours des prochains jours. Si vous devez faire des courses pour obtenir de la nourriture et d'autres biens essentiels, limitez la durée de votre sortie et retournez chez vous aussitôt que possible. Given these facts, Public Health has recommended to Cabinet that Zone 4 move to the red alert level as of midnight tonight. This will require many businesses to close or reduce services to essential levels only. We are asking everyone in Zone 4 to stay home as much as possible for the coming days. If you have to go out to obtain food and other essentials, please keep your outings brief and return home as soon as you can. And please be reminded of not traveling between zones. We did recommend that already, but we're just highlighting that fact again. We are again reminded of how quickly the COVID-19 virus can spread and how fast our situation can change. While the other zones will remain at the orange alert level for the time being, it is very clear that zones 1, 2, and 3 are on the cusp of moving to the red alert level. We are responding to limit the severity of this outbreak, but to bring this under control, we need every New Brunswicker to contribute. And I know back in March and since then, we have always talked about the fact that we didn't want to overwhelm our hospital system, but when you look at the three categories of triggers that we have, it includes the hospital system, it includes public health measures and the compliance with those public health measures, along with our public health contact tracing and testing capacity, as well as the rise in number of cases and the type of transmission that we are seeing. Every New Brunswicker in every corner of our province needs to follow public health direction and guidance. We have to redouble our efforts to demonstrate the resiliency which has made us a leader in controlling the pace of this pandemic. We can't undo the growth in cases that we have seen so far this month, but we can work together to make sure it doesn't get any worse. Voici les nouveaux cas confirmés de COVID-19 que nous signalons aujourd'hui. Il y a 5 nouveaux cas dans la zone 1, sur la région de Moncton et du sud-est du Nouveau-Brunswick. Dans la zone 2, qui comprend les comtés de Saint John, Kings et Charlotte, il y a 4 nouveaux cas. Il y a 2 nouveaux cas dans la zone 3, soit la région de Fredericton et du centre du Nouveau-Brunswick. Dans la zone 4, comme je l'ai mentionné, il y a 24 nouveaux cas. Il y a un nouveau cas dans la zone 6, soit la région de Bathurst et de la péninsule acadienne. Il y a maintenant 292 cas actifs de COVID-19 dans la province. Cela représente près du tiers de tous les cas signalés dans la province au cours des 10 derniers mois. The new confirmed cases of COVID-19 we are reporting today are as follows. In Zone 1, which is Moncton and Southeast New Brunswick, there are 5 new cases. In Zone 2, which is St. John, Kings, and Charlotte counties, there are 4 new cases. In Zone 3, which is Fredericton and Central New Brunswick, there are 2 new cases. In Zone 4, as I mentioned, there are 24 new cases. In Zone 6, which is Bathurst and the Acadian Peninsula, there is 1 new case. There are now 292 active cases of COVID-19 in New Brunswick, and that's nearly 1/3 of all the cases that have been reported in this province over the last 10 months. Very concerning. Across New Brunswick, 2,101 people are in self-isolation to help us limit the spread of disease at this time. There is 1 case in hospital. Please remember that behind these numbers, as stark as they are, there are people, and our fellow New Brunswickers have lives and jobs and families and friends who care about them, and I ask that you keep them all in your prayers and thoughts today. We are at a critical juncture in the course of this pandemic, and the next week will show whether we are heading for a further rapid rise of cases, or, as is now being seen in Maine and Quebec, or whether we are bringing this outbreak under control. We have the ability to turn the tide of the second wave, but it requires vigilance, caution, and the determination to make smart choices, which the majority of New Brunswickers have been making, and I just want to thank them for having followed all the public health directions and requirements thus far. By following public health direction and advice, you help make things better. You can do this by wearing a mask whenever you are out in public, and again, when I have been out in public recently, I have been seeing people wearing masks. You also need to wear your mask in your workplace setting as well. You also need to maintain 2 meters of distance between yourself and others, particularly in workplaces, schools, and other situations. You can wash your hands regularly, make sure they're disinfected. Everyone must be aware of the symptoms of COVID-19 and monitor themselves and their families. We do know that over the holiday season, there was a drop in testing. We wanted to see that maintain the level of testing we had prior to the holiday season. It has gone back up, but we would like to see it stay up and make sure everybody is being vigilant. If you have symptoms, no matter how mild they appear, please arrange for testing as quickly as possible. I know it seems like it couldn't happen to you and it's just a cold or it's just a runny nose, but these are the symptoms of the people that have tested positive for COVID-19. Please don't ignore them. If you are required to self-isolate because you have become infected or exposed to COVID-19, remove yourself from close contact with your family or others. And remember to be kind to yourself as well as to others. There's no question that this pandemic has placed a strain on all of us, but we can help one another to carry this burden. And if we all do our things, then we can limit the spread of the infections. We can protect our healthcare system and our most vulnerable citizens. La pandémie nous a tous mis à rude épreuve, mais nous pouvons nous épauler pour assumer ce fardeau. Si nous prenons toutes ces mesures, nous pouvons limiter la propagation de l'infection. Nous pouvons protéger notre système de soins de santé et nos citoyens les plus vulnérables. We can continue to move forward with our effort to vaccinate New Brunswickers and bring this pandemic to an end. Be vigilant, be aware, be supportive. We can get through this. Thank you very much.
Est-ce que tout le monde peut assurer de désactiver les sons de vos micros? Can everybody please place your microphones on mute? Mr. Carty.
Good afternoon, everyone. Bon après-midi, bienvenue. Throughout the weekend, there have been 4 additional confirmed positive cases of COVID-19 in schools across the province. In Zone 2, Belle Isle Elementary School in Springfield and Milledgeville North School in St. John have both had confirmed positive cases of COVID-19. Both schools will be open tomorrow, January 18th, and unless advised by public health, students should return to school. In Zone 1, Riverview East School in Riverview and Caledonia Regional High School in Hillsborough have both had confirmed positive cases of COVID-19. School staff will contact families directly to inform them of any impact on learning. In addition, students and staff at Caledonia Regional High School have been asked to stay home today as contact tracing is carried out. These cases bring us to a total of 14 schools and 6 early learning and childcare facilities currently impacted by confirmed cases of COVID-19 across zones 1, 2, 3, 4, and 5. I'd like to take this opportunity to remind families that if there is a confirmed positive case or possible exposure of COVID-19 in a school or childcare facility, that families in the school community will be notified directly by public health or the department or district. Otherwise, no news is good news. So we're committed to keeping you informed, up to date, with information as soon as it becomes available, while protecting the privacy of our students and staff as required by the Personal Health Information Privacy and Access Act. So I know these new cases add to the stress that families across New Brunswick are already feeling. I want to continue to thank the families of this province and the folks who work tirelessly inside our school system to keep it going day after day, whether those are teachers, EAs, the support staff, people in the district and in the department. It's going to be a difficult few weeks coming up, but as Dr. Russell said, we have the light at the end of the tunnel right now, which makes it all the more important that we not let our guard down. Your government is doing its best to adapt to changing circumstances. We have to ask the people of the province to continue to lead the way as they have over the course of this pandemic by also adjusting your behavior to better protect all of us from this deadly disease. Because all of us are continuing to hear the stories of people not following the rules. The stories of people, as Dr. Russell said, who maybe just feel like they've got a little bit of a sniffle. That is what makes COVID-19 so dangerous. The fact that it's so ordinary in its initial symptoms, or there are no symptoms at all. So when we hear the stories about people selling raffle tickets, going for chicken, famously, making trips around this province that have no real utility or purpose, when I get emails from people saying, well, there's nothing to stop us from traveling from zone to zone. And you know, we're in a democracy, in a free society. And you're right. You're not going to have the force of the law breathing down your neck, although more and more that is going to be required as our resources allow. But all we can do, again, is ask you as citizens, you, the tiny percentage of the population who are causing these difficulties for so many other people, who are isolating, in some cases alone, lonely, depressed, suffering. We can each play a part in pushing back against COVID-19. Do not think you have no power. Don't wait for the government to tell you what to do. Follow the rules. 2 meters. Social distancing. Wear a mask. Wash your hands. This is not rocket science. We've gone through this for nearly a year now. Au cours des derniers mois, nous avons acquis beaucoup d'expérience à gérer les cas dans les écoles. Je suis convaincu qu'en ayant votre collaboration et grâce à votre entraide et à votre bonne volonté, nous parviendrons à surmonter ces défis rapidement et de manière sécuritaire. Il faut offrir aux élèves des milieux d'apprentissage sains et sécuritaires pour favoriser au maximum leur réussite scolaire, la raison d'être du système d'éducation. Et c'est pourquoi que nous avons mis en place des plans pour faire en sorte que les écoles publiques puissent demeurer ouvertes, même s'il y a qu'un petit nombre de cas signalés. Nous avons collaboré avec la santé publique, Travail sécuritaire Nouveau-Brunswick, les écoles et les districts scolaires pour développer nos plans et nous assurer qu'ils tiennent compte des cultures et des réalités individuelles de près de 300 écoles de la province. So we've always said that our phase plans are living documents and will be updated as required. And of course, there's massive efforts going on inside government now to take into account both this spike in infections and the rise of new variants of COVID-19, and also, on the very happy side, the rollout of vaccines across our province. So we've always said again that we're going to be reflecting best practices and the most up-to-date knowledge that we have. So based on the experience and knowledge we've gained in responding to each individual situation, we know that the safest place for students to be right now is in school. We've seen this since September, when our schools have been orderly, well-run, led by excellent teachers and administrators and the support staff who help them get through each day. And they have managed to make school in New Brunswick a safe place to be. And of course, that's not just critical for the long-term academic success of our province's students, but also critical for their mental and physical well-being. So working to keep students in school as much as possible helps support our public health goals. Dr. Russell has pointed out that when students are at school, they're in that supervised environment with those strict health and safety protocols in place. Their social needs can be met while maintaining physical distancing, using masks, and, of course, the encouragement to maintain proper hygiene. That's why we support the recommendations of public health we've made to and have made the changes to our return to school plan that ensure students can stay in schools during the red phase following increased health and safety measures. I'll list through some of those right now. Those additional measures include students and staff being required to stay home if they have even one symptom of COVID-19. School staff will be actively screened when they report to work each day. And should a single positive case of COVID-19 be confirmed at a school in the red phase, that school will close to allow for contact tracing to be carried out. And in that situation, testing would also be available for staff on site. So these measures build on the orange phase health and safety requirements, including increased mask use, changes to physical education protocols, and limiting extracurricular activities. And more information is going to be available today on the Department of Education and Early Childhood Development's website, the Return to School website specifically on the ECD page. It's important that when we talk about why we want to try and keep schools open as long as possible, that we remember that every New Brunswicker under the age of 12 has to be under active adult supervision. And as we try and live through this last phase of the pandemic, obviously we cannot force large numbers, thousands of parents, to have to make that choice between the work that they need to put food on the table. And as Dr. Russell and I were talking about just before the briefing started, an income is a social determinant of health. So when we talk about this false equivalency between health and the economy, you need a strong economy to have a strong healthcare system. There's no two ways about that. So while I appreciate that there will be concern over schools remaining open, I am convinced and have been since late last year when this idea began to be discussed in the department that this is the correct approach. N'oublions pas que le mandat principal du ministère de l'Éducation et du Développement de la petite enfance est de s'assurer que chaque élève ait accès à une éducation de première qualité. Mais nous avons toujours dit que nous n'hésiterons pas à avoir recours au apprentissage à domicile quand c'est nécessaire. Ces décisions doivent toutefois être bien réfléchies. Il faut continuer d'agir comme si le COVID-19 pouvait survenir n'importe où. Il faut continuer d'être très vigilant. Les précautions et les mesures sanitaires que nous prenons servent autant à nous protéger nous-mêmes qu'à protéger les autres. Comme vous le savez, la situation peut évoluer rapidement chaque jour. Nous demandons donc aux familles de continuer d'être vigilants, de bien se renseigner en surveillant le courriel et leur téléphone pour toute mise à jour sur la situation. And so before we take questions, I'd like to remind parents and students that IT support is available for students and staff experiencing any connectivity issues related to online learning. Help is, as always, available through the Bell call center at 1-833-453-1140. Virtual counseling services and a variety of other wellness and mental health services are also available directly through our schools. And if anyone has any questions about that, please don't hesitate to contact your school, the district, or the department. En terminant encore, je remercie toute l'équipe scolaire pour continuer leur travail dans ce temps de crise. On ne va jamais oublier le fait que quand votre province vous a demandé d'aller en avant, vous étiez là. Et tout ce que je peux faire comme ministre responsable pour cet département, je vais le faire pour assurer que les sacrifices que vous faites sont reconnus. Everyone then, all I can say, and again, in close, please stay healthy, please stay safe, and continue to listen to Dr. Russell's advice in the coming weeks, because the vaccines are here, they are rolling out. So in that fight between the variants and the vaccine, let's take the side of the vaccine. Let's do our part, each of us. Because each of us have those choices every day. The journalists watching today, Dr. Russell, Premier Higgs, myself, we all have our role to play as citizens. When we go outside of this room to decide how we're going to engage with people, who we're going to engage with, and whether or not we're going to show in the way that we live our lives that we care about our fellow citizens in New Brunswick. Merci. Thank you.
Good afternoon. Bonjour. It's extremely disappointing to be here today, not because it's a weekend or Sunday, but because of the reason. We had hoped that putting the province to the orange level would be enough to balance out the rise in active cases that occurred over the past holiday season. While this step has helped, the numbers are definitely not where they need to be. We have seen what has happened in other jurisdictions, and when the increase in active cases is not dealt with quickly and decisively, it gets out of control. Nous avons vu ce qui est arrivé alors lorsque l'augmentation du nombre de cas actifs ne donne pas lieu à des mesures rapides et décisives. And as today's numbers of active cases show, we have not only reached a new high for both daily and active cases, but 2/3 of those cases are in Zone 4, the Edmundston region. And that is why today, Cabinet and the All-Party Cabinet Committee on COVID-19 accepted the recommendation of Public Health that Zone 4, the Edmundston region, be moved to the red alert level as of midnight tonight. Voilà pourquoi le Cabinet et son comité multipartite sur le COVID-19 ont accepté la recommandation de santé publique voulant que la zone 4, la région de Edmundston, passe à la phase alerte rouge dès minuit ce soir. It's important to note that while the other regions of the province will remain at the orange alert level for the time being, Zone 1, the Moncton region, Zone 2, St. John region, and Zone 3, the Fredericton region, are all on the cusp of moving to red in the coming days, and they will be monitored very closely. Under the red alert level, you must stick with your single household bubble. Outdoor gatherings are reduced to 5 people or fewer with mask and physical distancing. Les rassemblements extérieurs sont ramenés à 5 personnes, ou moins avec le port de masque et la distanciation physique. You cannot eat in at restaurants. Drive-through, takeout, and delivery only. On ne peut pas manger au restaurant, dans ce sont les services au volant, le mettre à l'emporter et la livraison seulement. Gyms, hairdressers, and entertainment centers are closed. After thorough analysis, it was decided that schools will remain open under the red alert level, and the addition of strict measures to ensure the health and safety of both students and staff. As Minister Cardy mentioned, we made this decision because we know that closing schools and moving learning online has repercussions beyond the classroom. Comme le mentionnait le ministre Cardy, nous avons pris cette décision parce que nous savons que la fermeture des cours et le passage à l'apprentissage en ligne a des répercussions au-delà de la classe. At the same time, we must do everything we can to keep everyone safe and slow the spread of COVID-19. As today's number of active cases shows, the virus is indeed on the move in our province. And it's on the move because people are carrying it all around the province. To stop it, we must stop moving, or at least reduce our movements to the absolute necessities. If you don't need to go out, stay home. And you are the best one to determine whether it's necessary or not. All the family doesn't need to go shopping for groceries. We need to be selective. We need to make trips count and keep them to a minimum. If you need to go out wherever you go, then return home as quickly as possible. And avoid that one extra stop wherever you can. The less we're moving around, the fewer people we see, then the quicker we will be able to get this under control. Le moins de déplacements, le moins de personnes qui nous voyons. Nous pourrons ensuite maîtriser cette situation aussi plus rapidement. We must be proactive if we are to slow the spread of COVID-19 in our province. Nous devrons être proactifs si nous voulons ralentir la propagation de la COVID-19 dans la province. We need to buy time for the vaccine to be rolled out. We must all take this seriously because the next step after the red alert is an entire lockdown. We have seen that in our neighbors in Quebec, in Ontario, and further west. We do not want to be in that position. And the reality of this is that we can avoid it. It takes each one of us to do our part. So we certainly do not want to see a lockdown here, but if we're going to avoid it, we must do it together. We need to take the virus seriously. We can no longer take the attitude, oh, it won't happen to me. Oh, just this once. Or we'll get together and talk about it. We must stay home. We must keep ourselves safe. We must protect ourselves, and we must protect others. Thank you. Merci.
Thank you, Premier, Minister Cardy, Dr. Russell. Merci, Monsieur le Premier Ministre, Ministre Cardy et Dr. Russell. Nous allons maintenant procéder aux questions des journalistes. Vous avez le droit de poser vos questions dans la langue de votre choix. Chaque journaliste aura une question et un suivi. Voulez-vous assurer de désactiver le son de vos micros, s'il vous plaît? We'll now proceed with questions from members of the media. You have the right to pose your question in the language of your choice. Each reporter will have one question and a follow-up, and please ensure your microphones are placed on mute. Silas Brown, Global TV.
Thanks, Bruce. This is for Dr. Russell. Looking at the situation in Zone 4, you said a lot of this seems to be connected to a workplace. I'm curious what amount of a role that workplaces are contributing to spread right now, and if we're starting to see workplaces and other situations supplanting travel as the main driver of some of the spread.
It's a great question, Silas, and our epidemiologists work really hard at putting together a picture of what the whole province looks like, also in terms of the timing. So we know that at the Christmas holiday period, gatherings were contributing to the outbreaks. People not getting tested who had symptoms and going to these gatherings or a workplace was contributing to the outbreaks. We also know that travel will always contribute to outbreaks in the sense that our borders are not completely closed. So we have been looking at all different ways of tightening up our borders in terms of who we let in and what they have to do once they get here. So that's in terms of all of the things that we're trying to use right now in our toolbox to clamp down on these outbreaks. But once we went into the orange phase and once we saw that, gatherings were no longer contributing to the outbreaks, once we got into the orange phase, there were still the after effects of the yellow phase prior to that. And then the ongoing travel-related cases are still happening. We are still seeing a lot of transmission in workplaces. So you are correct. I don't know that it's transplanted travel completely at this point, but certainly anybody who goes to any setting, whether it's school or workplace, with symptoms and is not getting tested is contributing to outbreaks and spread. People who don't wear their masks in those settings can contribute to spread as well. And people who aren't self-isolating properly can contribute to spread at this moment. So again, we're really trying to make sure that everybody understands that they have to do their part right now to settle these outbreaks down. And obviously, we had gone to the Edmundston area on Friday to have an engagement session with the leadership in that community. We visited the Vitalité staff. We also visited the public health team there to give them some moral support and encouragement. I think the public health teams all around the province are really have really stepped up in terms of the efforts that they've been putting into this throughout the pandemic. So if you can give a shout out to somebody you know is working in public health right now, or even public safety, et cetera, those are the people on the ground that are doing the hard, heavy lifting right now.
Thank you, Doctor. Mr. Brown, do you have a follow-up?
Yes, thank you. This is for either Dr. Russell again or for the Premier. The big message here, particularly in red, seems to be stay home as much as you can. But looking at the red phase rules, we're still going to have people going to school. There's still going to be a lot of people going to work, and you're still able to, for example, go to the mall. You can still go shopping. So I'm curious if that's then a bit of a contradictory message here of allowing people to do much more than we actually maybe want people to be doing.
Well, when we say essential, I mean, again, how often do you need to leave your house to do something essential? For work, obviously, we have to go to work if you can't work at home. For children, there's a couple of really good reasons for children to be in school. One, from a social determinants of health perspective, we know that education is a key component to people's mental health and well-being. Again, we saw the suffering that mental health in school-age kids in the first wave. We don't really want to see that. I think we're still seeing effects of that even in the older students who can't go to school every day. And as Minister Carty mentioned, that those people who wouldn't have options for daycare alternatives when they're trying to go to work with kids at home would present some problems. So I hear what you're saying in terms of those contradictions, but we've always tried to approach all of these things since the first wave from a social determinants of health perspective. Protect the healthcare system, protect education, protect people's incomes, protect people's mental health.
Thank you, Doctor. Gary Moore, CBC.
Thank you, Bruce. I'm just wondering what's the most concerning thing about what you're seeing in the Edmundston region right now?
Frustration in my public health teams. They really are working really hard, and I think when we did see a few cases where situations emerged that it was found out that people were not giving truthful information, they weren't providing all the information, and that slows everyone down because then we can't do the contact tracing as quickly as we need to, because the key to being successful with COVID-19, one, is to stay ahead of it, and if you can't stay ahead of it, get caught up really quickly to get ahead of it and stay ahead of it. So that's what we're trying to do very diligently across this province. Obviously, when we see outbreaks in vulnerable settings like long-term care facilities, we do have our prompt teams going in very rapidly and making sure that they can get those situations under control very quickly. As Minister Carty said, we will have a process in place where if there is a case associated with a school, they will be shut down for that contact tracing period. So what I'm concerned about, again, is the number of cases is not going down with the orange phase measures in place, and that's why, in particular in Zone 4 today, we're going to the red phase, again, to try to get those numbers down. And again, if we have to go to red in Zone 1, 2, and 3, which are not far behind in terms of risks, we will be looking, having our regional staff looking into declaring outbreaks at businesses in those situations where necessary. But again, we're rolling up our sleeves right now and trying to get ahead of COVID-19.
Thank you, Doctor. Mr. Moore, do you have a follow-up?
I do. Dr. Russell, we're hearing, I guess, the spike in cases in the Edmonton region due to an outbreak at a poultry plant. Are you able to give us any more specifics about the workplace incident that was mentioned earlier?
Well, I can tell you that a facility was mass tested in the last couple of days, and we are, again, the number of cases we're reporting today in that zone is as a direct result of the mass testing that we did at that place of business. So we are doing all we can to target the areas that we know are at risk right now, and we will continue to do so.
Thank you, Doctor. Thank you, Mr. Moore. Vicky Hogarth, CHCO.
My question is for Dr. Russell. Thank you, Bruce. Dr. Russell, has New Brunswick's future supply of the Pfizer vaccine been impacted by Pfizer's production delays? Are you concerned that our supply might be decreased by news of shipment delays from Pfizer?
Well, as you know, from the beginning of the rollout plans for vaccination, we did get a certain allotment of Pfizer dedicated to New Brunswick in the course of the next several months on a per capita basis. So we are aware that our immunization task force participated in a call Friday afternoon with Major General Danny Fortin, who is leading the distribution on behalf of the Government of Canada. And we do have a revised allocation schedule from the federal government, which is coming Monday. My understanding is it's not going to change things by a lot. We'll still be able to meet our targets, but we'll just have to adjust some of our timelines.
Hogarth, do you have a follow-up?
Thank you, Bruce. It's also for Dr. Russell. Dr. Russell, you mentioned on Thursday that there were 3 confirmed cases of COVID-19 that are under investigation for possibly being community spread. Do you have an update on those cases?
I don't have updates on those, but as soon as I do, I will be reporting on those. I can tell you that we do have several cases that are still under investigation for community transmission, and that is something that is on our list of triggers for going to red, so it is being looked at extremely closely at the moment.
Thank you.
Thank you, Ms. Hogarth. Thank you, Dr. Derek Haggard, Times and Transcript.
Thank you. My question is for our Education Minister, Dominic Carty. Minister Carty, you've repeatedly said that the schools are safe. What do you say to the parents who received letters this weekend, superintendents and principals, about these new positive cases? How do you reassure them that our schools are safe?
Thanks for the question. We've had over 20 schools where COVID-19 has breached the walls of those buildings and has been successfully pushed out, in most cases with a single case, occasionally 2 cases. So what I'd say to the parents is that, as we've had repeated it millions and millions of times over the last 9 months, that COVID-19 is all around us. It's ravaging neighboring states and provinces, and now it's here in New Brunswick in numbers much larger than we could possibly want to see. So it's not a question of pretending that we can hide from the virus. It's a question of what can we do to stop it from spreading. And what we can do to stop it from spreading are following all the measures that the Premier, Dr. Russell, have identified around restricting travel and making sure that we limit our contacts as much as possible. And in the schools, making sure that we have our kids in school, because we have put an enormous amount of effort into a plan for the safe reopening of our school system that has worked. The goal was never to avoid all cases. I've gone back a number of times to a statement I made, I believe, in early July of 2020, saying that we will have cases of COVID-19 in our schools. At that point, I said we will have deaths. That, thank God, hasn't happened yet inside the school system. But this is a defensive action while we wait for the cavalry to arrive in the form of the vaccines. So we cannot guarantee that we can avoid COVID-19. All we can do as individuals is take steps to protect ourselves and our family against it. And our responsibility here on this side of this podium, on the government side, is to make sure that we provide as many structures that will help make sure that goal is as easy to achieve as possible, of keeping the virus at bay and then pushing it out once the vaccines are rolled out. Schools are controlled, have clear plans, and as you heard today, we're increasing the security measures in the schools so that a single case will result in a school being closed in a red zone. So we're making those efforts. La seule chose que je peux dire aux parents aux familles qui sont inquiétées que notre plan ait survécu jusqu'à ce moment, presque 2 douzaines de contacts avec l'ennemi, le COVID-19, et on essaie tout le temps de regarder comment est-ce qu'on peut repousser le virus, et c'est clair, basé sur l'information de santé publique et l'évidence des derniers mois, qu'on a vu qu'on a réussi à repousser le virus hors des écoles quand ça arrivait avec 1 cas, 2 cas, des petites éclosions. On peut voir maintenant que les écoles sont un endroit sécuritaire, sanitaire, un endroit approprié pour les jeunes de notre province. Because the more people we can keep out of uncontrolled gatherings and wandering around, the better. And the school system's there to do our part, and I know our teachers and our staff are up for the job. Thank you.
Thank you, Minister. Mr. Hackett, do you have a follow-up today?
Yes, one for Dr. Russell, and I apologize, you may have mentioned this in your opening remarks, but for the regions that are on the cusp of going back into orange, will that decision be made within the next day or two, and is it solely dependent on our numbers?
That decision will be made in the next day or two, and we have 3 categories of triggers. So one of the categories is the number of cases, how quickly they double, if it's community transmission, if they're in vulnerable settings, the epidemiology, that's that category. The public health category is testing, contact tracing, public health compliance, and also in the 3rd category it's hospital capacity, so ICU beds, hospital beds, and staff that could be impacted.
Thank you, Mr. Hackett. Thank you, Dr. Alexander Silberman, CBC.
Yes, question for Dr. Russell. With the record number of cases we're seeing in the province today, why is it only Zone 4 that's moving to red?
Well, again, we review the numbers every day, multiple times a day, actually. And in terms of having the most concern, Zone 4 is where we have had the most concern, even leading up to this. That's why we went to the Edmundston area on Friday. Myself and the Deputy Minister and Assistant Deputy Minister Liston, we went to meet with the leadership there. We also met with Vitalité leadership. We also met with our public health team. We really wanted to, again, show our support, hear their messages around what they were seeing, and then how we could mitigate the risks. But at this point in time, it was clear that with the increased number of cases actually they're declaring an outbreak at the Nadeau Poultry facility in Saint-François de Madawaska. So we, again, our concerns are in multiple places all at once, but again, this was the place that was the most concerning and most pressing.
Mr. Silberman, do you have a follow-up?
Yes, I have a follow-up for Dr. Russell. We know the Edmundston region borders closely Maine and Quebec, which have both seen huge spikes in cases recently. What role does this play in the fact that the Edmundston region has now become a hotspot in New Brunswick?
Well, I think the proximity of New Brunswick to Quebec and to Maine has always put it at an increased risk. And we have talked about the fact that we are gatekeepers to PEI and Nova Scotia in that way, that we are directly next to these borders. So I think there was always an elevated risk because of that. But really and truly, any type of travel anywhere into the province, whether it's by air or car, can bring COVID-19 cases with it inadvertently. So yes, the risks are higher in those areas, and obviously the enforcement pieces around our borders and our border measures have been really, really key to keeping COVID-19 at bay for as long as we have. But honestly, the pressures are increasing because the number of cases have been increasing globally, nationally, and also in Maine and the rest of the U.S. So I don't think it's completely unrealistic to think that, with the cases going up exponentially elsewhere, that risk was going to go up here in New Brunswick as well, which meant that all the things that we have been doing up until now, we would have to ratchet up and ramp up our approaches based on those increasing risks. So again, putting the orange phase into place was supposed to do that. We didn't see the turnaround in the numbers that we wanted to, but again, we're fighting against a very, very high risk outside of our borders immediately, and globally as well.
I'm just going to add a point to this. we've tried very hard throughout this entire process to allow people to go about their routine living with COVID as much as they possibly can, and try to keep businesses and people moving within their routines, albeit protect themselves at the same time. And that's been very successful for the past 10 months. And so what we've seen is a complacency that set in over the holiday period, and we're still trying to recover from that. And many people thinking they're immune. So while we may end up going into the red zone for the entire province, when we were in the orange zone for the entire province, it seemed that people in many ways felt, well, the whole province is orange, so despite our warnings not to travel between zones, and it was a concern that that was actually happening. So we may have to get there with all zones, but right now we have a zone that's turning red, and people need to stay contained within that zone, and they need to stop moving within that zone, and we need to not move in and out of that zone. So let's look at that and say, okay, we were successful for many months by having one zone at a time, or maybe 2 or 3, and not the whole province. And that worked very well right up until this last situation in orange. Let's try to avoid the whole province going in red. Let's really focus. Let's get the Edmonton region fixed. And let's just focus at home in other regions like we are in red. Let's stay home. Let's avoid getting there because we do the right necessary steps as if we were there.
Thank you, Premier. Thank you, Doctor. Ben Burnett.
Thank you, Bruce. I'm wondering about the comments that Dr. Russell made about Moncton, St. John, and Fredericton being on the cusp of red as well, and in particular the mention that we will know within the next day or two. Due to the virus's gestation period or incubation period, there is a lag in reporting new cases. Are we expecting to see spikes there, or what sort of trends are we currently seeing that are troubling to you in those regions?
So the trends that we have been watching for throughout the pandemic, again, they fall into 3 categories, but right now the doubling time of cases across the province in those zones is increasing dramatically. We're also seeing some unlinked chains of transmission, which makes us very concerned about community transmission. We're still investigating that. Again, we just know that, again, our healthcare capacity can be impacted 2 or 3 or 4 weeks out if the number of cases goes up above a certain amount, and if a percentage of those are in the elderly population, which we know has a high risk of needing hospitalization and ICU beds. So again, it's not just what's happening today. You're right. It's about what happened a week ago and 2 weeks ago. But if we act now based on the triggers that we're using for our risk assessments, including contact tracing and testing capacity, because again, we're sort of at the maximum of what we can deal with in the short term. So we're not over capacity in terms of the short term, but if we don't turn this around and we have to try to sustain the level of cases and contact tracing and testing that we have to with this number of cases, there would be a time when there would be a turning point where we wouldn't be able to keep up. So we don't want to arrive at that point and then put new measures in. We'd like to preempt that. It's the same thing with the hospital capacity. If we wait until we're beyond the hospital capacity in terms of putting measures in, then we've lost. So we're trying to be proactive and preemptive based on our risk assessments on these triggers.
Thank you, Doctor. Mr. Burnett, do you have a follow-up?
Yes, thank you. In other neighboring jurisdictions, we've seen some mass testing among different populations in Halifax and in PEI as well. I'm wondering if there are any plans for mass testing or increase in testing capacity to match the spike that we're seeing.
So far we have not had a problem meeting demand in terms of capacity, and when we see an area that needs to have more access to testing, we have been adding extra testing. So in Zone 4 we've added an extra testing area within the hospital, and so that's in addition to what was already there. We have done the mass testing at the Nadeau poultry facility. We try to be very targeted for a number of reasons. One, since the beginning of the pandemic, the message has always been test the right person for the right reason at the right time. When we have done mass testing, again, we've been very happy with how the process went. But out of 3,000 plus case tests in the Campbellton and Dalhousie area in their last outbreak in Zone 5, I think we only found 2 cases out of that mass testing. Does that mean we shouldn't have done it? No, not necessarily. We were very worried about community transmission, and what we found out after the fact, after 4 weeks of investigation, all of the unlinked chains that we thought we had found actually then finally were linked. So it just took a lot longer to make those connections and rule out community transmission at that point in time. So we won't rule out mass testing as it's needed, but for right now, we're happy with the targeted approach that has been working for us so far. Again, if things go to the point where we are worried about community transmission, then we'll have those conversations again.
Thank you, Doctor. Thank you, Mr. Burnett. Marie-Ève Brassard, Radio-Canada.
Oui, bonjour. Une question après pour la docteure Jennifer Russell. Premièrement, en fait, je me demandais si vous étiez en mesure de déterminer combien de travailleurs, combien en fait de cas dans la zone 4 étaient liés à Nado Poultry.
Je savais cet numéro. Ce matin, je le savais. 11.
Parfait, merci. J'ai aussi, en fait, j'aimerais savoir si c'est possible pour vous de répéter en français ce que vous avez dit par rapport aux critères pour le passage en phase rouge des zones 1, 2 et 3 et qu'est-ce que vous surveillerez là, dans les prochains jours?
Alors, c'est les mêmes déclencheurs qu'on surveille depuis le commencement de la pandémie. C'est 2 différentes types de critères. Épidémiologie, ça veut dire le nombre de cas, combien vite on va voir le nombre de cas doubler dans un tel nombre de jours. S'il y a de la transmission communautaire, le deuxième critère, c'est au niveau de la santé publique et si on peut faire le traçage des contacts étroits vite assez, si on peut faire les dépistages vite assez et s'il y a de la coopération avec le public, avec les directives de santé publique. Et le troisième sorte de déclencheur, c'est au niveau des hôpitaux. Alors, les services de santé, s'il y a un impact négatif sur le nombre de lits dans les soins intensifs, s'il y a des problèmes avec les capacités d'avoir des admissions à l'hôpital, soit parce qu'il n'y a pas assez de lits ou soit parce qu'il n'y a pas assez d'employés pour donner des services à cause du COVID, soit parce qu'ils sont infectés avec le COVID-19 ou soit parce qu'ils sont en auto-isolement parce qu'ils sont identifiés comme un contact étroit d'un cas de COVID-19.
Merci, Mlle Brassard. David Caron, l'Acadie Nouvelle.
Oui, j'ai une question. On s'est habitué aux phases rouge, orange, jaune et vert, mais le premier ministre a évoqué la possibilité d'un lockdown si ça allait vraiment mal, mais je me demande qu'est-ce qu'il faudrait qu'il arrive pour qu'on en arrive à cette mesure drastique à 2020.
I guess at this point, if you talk about think about what we're seeing across the country, when we're seeing major centers, certainly in Quebec and Toronto and Ontario and looking across into Alberta, where basically business closed and people we just stop moving, and then it comes to the very basic essentials that actually are allowed to continue. So at this stage, what has to happen? Is that we don't see a continuation of cases that become out of control. Dr. Russell talked about the fact that we're able to still contact trace and understand where our cases are coming from. That is not the case in Quebec or in Ontario or in Alberta. That is the difference. I feel, I'm so impressed and so proud of the team that are working to do this tracing and to contact people. And it's so discouraging when you hear people that aren't telling the truth or they're being deceptive in where they've been and who they've talked to and what they did. Because as I've said in previous press releases, this isn't about it's a shame or you should be ashamed of having COVID. This is about let's be honest about this and let's just deal with it. So if we get to a point where we have no idea where the cases are coming from and they're coming at us from all directions, then that is the trigger when things start to shut down and we close the doors to get back under control.
Merci, M. le Premier ministre. M. Caron, as-tu un suivi cet après-midi?
Non, les collègues ont bien posé leurs questions.
Bien sûr.
Oui.
Merci. Voilà la fin de notre mise à jour pour aujourd'hui. Merci beaucoup. That concludes today's update. Thank you very much.